PCEA, patient-controlled epidural analgesia, is most common used in obstetric patients. Approximately 90% of all women in labor get an epidural. It's also used in certain surgical cases such as thoracic surgery, abdominal surgery, and orthopedic surgery. The epidural catheter is inserted into the epidural space, which is a fluid-filled space around the spinal cord. The anesthesiologist inserts the catheter at the site of which he wants to be anesthetized. So if the patient is having some type of thoracic surgery, the epidural catheter would probably be inserted in the thoracic spine at the level of 5 or 6. The catheter is injected and the medication is injected through there and travels down through the spinal cord. So from the level of insertion and down is where the patient is usually anesthetized. In a laboring patient, it would be probably put in the level of the lumbar area of 2 or 3, so they will be numb from here down. A numbing medication such as bupivacaine and a narcotic such as fentanyl is what's infused through the epidural. The same protocol follows epidural Pcea in initially setting it up, and the nurse's responsibility of documenting vital signs is the same as regular IV Pcea. The button is also very similar to the IV Pcea. You press the button and that's how you get your bolus dose. There are side effects with epidural Pcea: nausea, vomiting, itching, shivering, headache, low blood pressure, less commonly back pain after the catheter has been removed, and muscle weakness in the lower extremities, which is a normal side effect of the Pcea, of the epidural Pcea. Once the Pcea catheter is removed, usually within an hour or 2, depending on the patient, you do regain your feelings in your legs, but before the patient gets out of bed for the first time, it has to be with the assistance of a nurse.